Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Today, Stephanie Desmond talks to Gigi Granval from the Johns Hopkins Center for Health Security about the COVID-19 vaccine rollout. They discuss distribution challenges, vaccine side effects, and why sticking to the recommended 2-dose regimen makes more scientific sense than giving more people a single dose of vaccine. Let's listen.
Gigi Granval, thanks so much for joining me.
Thank you so much. It's great to be here.
So we're going to talk today about the COVID vaccines. And the thing on everyone's mind, I think right now, is a conversation that's being had. The vaccines that we have available now are much more effective after 2 doses, but there's a conversation because of a shortage of vaccines that maybe we should give 1 dose and then a second dose much later. So I'm curious if you could sort of explain that to us a little and then tell us about, what that means.
Sure. So everything is really, there's this ideal case where we have as much supply as we need. We have a lot of people who are willing to take it, and then we give them vaccine, right? So unfortunately, not all of those variables are fantastic. So we have a great need to vaccinate people as quickly as possible because, we want to protect people from COVID, but also we're concerned about new variants popping up of SARS-CoV-2. So the UK is moving towards this position where they're thinking of just vaccinating people once, getting good coverage for 1 vaccine. I am not, and this conversation is happening here too. Unfortunately, we don't have as much data to go on about how good a strategy that's going to be. We have a lot of data about how good a 2-dose regimen is for the Pfizer and Moderna vaccines. And that's the way that the clinical trials were conducted. And that's what we know produces this very high rate of efficacy. And so I think the better strategy would be to continue with the 2-dose, but maybe test the 1 dose and see how well that works and see how, if that's something we may move to in the coming months. But I would really rather see this work and see us boost supply of vaccine for something that we know is going to be effective and just opening it up so that more people can get vaccinated.
And you alluded to this before, is that the vaccine distribution is going slowly. We were promised, I think it was 40 million doses in 2020. We had about 2 million doses distributed in 2020. So here we are in a new year. And what should be done, in your estimation, to speed this up?
Yeah, so there are a lot of variables here. It's really going to be the most complicated public health operation that has existed, in our lifetimes to be able to get people vaccinated. So I don't want to diminish the scale and the difficulty of what's going on, but there are definitely things that could be done to make things better. The first thing is, what we're seeing with vaccine distribution and administration is not unique to the vaccine. We've seen similar types of fragmented responses when it comes to testing. We've seen similar responses when it comes to availability of personal protective equipment or PPE. So what we're seeing is this, very decentralized state by state, city by city strategy, which sounds good on paper, I guess, although it doesn't really sound that great on paper to me. I would like to see a more national, more federally directed response so that everybody is, that you're able to streamline things a little better and that there's more uniformity between the states.
When you talk about the states, I saw that in New York State, the governor has said, we're going to fine you $1 million if you give the vaccine to someone who's not on a priority list. And then I just actually saw someone tweet out of DC, which said, there was an extra dose, and then rather than let it go to waste, someone was walking by and we got them the shot. And to me, it seems like the more people who can get the vaccine, the better. What are your thoughts?
Yeah, I agree with you. I think that the more people that can get the vaccine, the better. I think the priority groups reflect a couple of different things that are important. They reflect trying to get the people who are most vulnerable to the worst effects that we know of COVID to the top of the list, to the front of the line. And that reflects our values, and that's fantastic. It also reflects the people who we most rely on for this crisis. So we need healthcare workers. They are in a position of potential risk, but we also need them to be there because we are experiencing this crisis. So putting them to the top of the list is also a good idea. But at the end of the day, we want big portions of the country to be vaccinated. We've spent a lot of the last year talking about what is and what is not needed to be able to get herd immunity of the population to SARS-CoV-2. There has never been an ability to have herd immunity without a vaccine. Well, we now have a vaccine. So the ultimate goal of the vaccination effort should be to get herd immunity to this disease. So it's going to be harder, especially with a new variant that might push up the percentage that's required. But ultimately, we need to get more people on board.
Yeah, and it feels like the last mile is where this is sort of falling apart.
It is the most important mile, though, and that's the thing. Technological achievements. It is amazing. As a scientist, it's truly amazing how fast we've managed to get vaccines available. I teach a class on 1918 flu, and one of the things that is really so sobering to think about is that at that time people didn't know what was causing the disease, and it wouldn't be proven for 14 years. Okay, to even know what was what happened. And this time we know what happened within days. We've got vaccines within a year. It is amazing. But, you can engineer a lot in the span of manufacturing facility or in the span of a room, a laboratory room. It's when you get out into the real world that things are a lot more complicated. There's a lot more variables. There's a lot more politics involved. The distribution chains are challenging. Both vaccines require some challenging distribution mechanisms, especially the Pfizer vaccine, which requires ultra cold storage to be able to keep it around. So it's a lot of logistics, and that requires a lot of people adhering to the same strategy and knowing what they're doing. And we have a lot of strategies. I think a lot of strategies that the states might have could be perfectly good ones. It's just that we have too many of them.
So I also wanted to ask you about potential side effects from the vaccine. I understand that it's not quite like getting the flu shot.
Yeah, when it comes to a flu shot, which everybody should get, by the way, if you haven't already, even though flu rates are lower this year, you really don't want to have flu and COVID. That would really be terrible. Flu is bad enough. So, usually you get a sore arm at the most. Some vaccines just cause more side effects. And this is one of those. It's been compared to the vaccine that people over 50 should get for shingles, to prevent shingles, Shingrix. Has a few more like headaches, tiredness. It's not everybody, but about half of the people who get it will have one of these, like being tired or having a sore arm. Some people say it's an indicator that it's working, and that might be the case for this particular vaccine. But it just is. It's these symptoms resolve in a day or two, and they're thought to be less severe than the Shingrix vaccine. So, and people line up to get that one because it's a good vaccine. And so far, from all the data that we have on these vaccines, they are extremely protective. So, it's one thing to go through a little bit of a sore arm for something that doesn't work very well, but this does appear to work quite well.
Mm-hmm. And people shouldn't be put off. People should just know that this might happen once they get one of these vaccines.
Exactly. And another thing that has been very variable from one place to another is so the CDC has put out a text messaging service called vSafe. So when you get vaccinated, you can register with the CDC, and they'll ask you to make sure, about your side effects, and you can be assured that if you have any side effects, that they are quite normal. And they will also remind you when it's time for your second shot. We're starting to look to see if there's a way that we can characterize this, but from some informal polling of my friends that have gotten the vaccine, a lot of them weren't told about this vSafe messaging service. So something to consider if you get vaccinated.
Yeah. So we also have heard, and it feels as though this is being overblown, that there is some minor anaphylaxis risk. Could you talk to me a little bit about that?
Sure. So there have been some people who are potentially allergic to one of the components of this vaccine. There's not a whole lot that's in this vaccine. So it's probably a cross reaction to the polyethylene glycol in the vaccine. But for most people, the CDC is recommending that even if you carry an EpiPen, even if you're allergic, as you know, and I take Zyrtec every day, if you have any kind of like allergies to things that are to spring, I have spring and fall allergies, you should still take the vaccine. In fact, only people who have been hospitalized for allergic reactions, they're recommending that you wait once being vaccinated in the medical facility that you get the vaccine for 15 to 30 minutes to make sure that there is no problem. But they aren't really excluding anyone. And even pregnant women, they're not, we're still gathering data on how well the vaccines work in pregnant women. But they are not excluding them from getting the vaccine because there is evidence that pregnant women don't fare as well as non-pregnant people for getting COVID. So the risk may be enough to consider getting the vaccine. And so a lot of pregnant people have already gotten the vaccine with no problems.
That's great. So my friends and neighbors are always asking me COVID advice questions. I am not a doctor, but I do interview a lot of really interesting scientists and medical professionals. And one thing they keep saying is, well, which vaccine should I get? And I say, you should get whatever they'll give you. So I'm wondering what you say in the situation like that.
Yeah, I mean, it's hard. Just to clarify, I'm a PhD, not an MD, but there's all of the vaccines go through a rigorous clinical trials examination. There are independent advisory committees that really kick the data to the curb, or kick the tires, whatever the metaphor is. They really look at, to make sure that the data is enough to support the emergency use authorization. So I feel very confident that if a vaccine is available, that it's a good idea to take. Both the Pfizer and Moderna products have reduced risk 95% in clinical trials. So basically what that means is if you and a friend are exposed to COVID at the same time, and you're vaccinated and your friend isn't, your risk of coming down with disease is 95% reduced compared to your friend. And that is significant. And so, even a vaccine that's a little bit less of a reduction in risk is going to be a good idea. And there's some evidence that it'll help you, even if you get the disease, to stay out of the hospital. So that's another good reason for flu vaccine, by the way, too. So yeah, I'm ready to take whatever is available. So that would be my recommendation.
And that is what I tell them. Gigi Gronvall, thank you so much for joining me.
Thank you.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Hagedor, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.